Well, more than 29 million Americans identify with the stigmas of substance use disorders that keep many in the shadows.
But there is help available for those who choose to fight back while recovering out loud. So here to talk more about what that means is Dr. Daryl Shorter, the Addiction Services Medical Director at the Menninger Clinic. Good morning.
Good morning. Thanks for having me.
All right. So what exactly does it mean to be recovering out loud?
When we talk about recovering out loud, we're talking about throwing away and dismantling stigma and being out and proud with one's recovery from either mental health conditions or substance use disorders. It's about sharing with your friends, your family, and your community your experience of living with a history of addiction and what it means to recover from it.
And it seems like what we do see, though, is so many people trying to hide it. Maybe they're embarrassed or just discouraged. How important is it for people not to hide this recovery process?
Well, first, it's important to recognize that if anonymity is a major part of your spiritual practice, or if you are involved in something like Alcoholics Anonymous or Narcotics Anonymous, and it's really important to you to remain silent because it's safe for you or important for your recovery in order to maintain it, then absolutely you should do that. However, it is also important for some people to really throw down the guilt and the shame that can really keep people silent and also can contribute to those feelings that maybe I do need to return to substance use in order to manage uncomfortable feelings, negative feelings of depression or anxiety. And so we really want for people to choose those things that are best for them in regard to their recovery, and also to encourage people to live out loud if they can, to really dismantle the stigma that impacts so many people and keeps them from receiving treatment or accessing care.
And Dr. Shorter, is this different for different people or even different addictions where people may think that one addiction or substance abuse disorder that might be more acceptable than another?
Absolutely. So we have in our society a hierarchy of substances where certain substances are really, really bad, and other substances, it's not so bad that you might struggle with those types of substance use disorders. I really try to encourage people to really think more broadly about the experience of our relationships to substances. And if you're experiencing a problematic relationship to substances, just thinking about how to access care, receive treatment, and get support from people is really the most important aspect of these things, not focusing so much on whether or not it's alcohol versus cocaine or methamphetamine versus heroin.
Now, what would be your best advice for someone who's watching right now and say, my goodness, it's time for me to try a recovery program? What would you suggest to them?
The one thing I would suggest is that recovery is possible and that there's really no one singular pathway to recovery. There are multiple pathways to recovery. And so it's possible that you could try lots of different things. There are mutual help groups, like I've mentioned, AA or NA. There's also things like Smart Recovery or Recovery Dharma. You can also try to seek psychotherapy. There are plenty of psychotherapists and counselors who manage and try to work with people that are having problematic relationships to substances. You can seek out the help of a psychiatrist like myself. I'm an addiction psychiatrist, and I oftentimes will prescribe medications to help people cut down or stop their use of substances. And so ultimately, trying lots of different things, because there's so much treatment available right now, and recovery is absolutely possible.
Dr. Shorter, do you recommend anyone reaches out to their inner circle for that support as well, right before we go?
Absolutely. I think if you have a supportive group of people in your family, certainly in your friendship group, that can also be really a powerful part of the overall recovery process.
Dr. Shorter, I can tell you are such a positive force. Thank you for taking time for this important conversation. I hope people will take your advice very seriously. Appreciate your time for Menninger Clinic.
Thank you so much for having me.